The impact of perceived effectiveness of non-pharmaceutical interventions. Does age have an impact? Thompson Rivers University, Business 50/50 Marketing Management, team number 3. This presentation will cover the outline, introduction, data analysis, testing the hypothesis, implications, limitations, and conclusion. What is an NPI? NPIs can be defined as measures that are not medical procedures or vaccines to control the spread of any illness like influenza, flu, or COVID-19. Examples of NPIs are travel restrictions, lockdowns, quarantines, contact tracing, staying at home, wearing a face mask or shield, maintaining social distance. The implementation of these NPIs showed great effects in curbing the spread of COVID-19. The technology acceptance model is a theoretical model that describes the various elements of acceptance of a new technology and studies the impact of external factors in this acceptance. The theory helps to understand why and how a new technology is accepted and adopted. This model focuses on how humans perceive the technology, how people perceive the use of technology, and the ease of use of technology matters more than the actual use of the technology, which is predominantly affected by one or more external factors. Depending upon the predisposition for any new technology, age, experience, gender, and other demographics, the perceptions about technology can differ. Perceived usefulness. Are the proposed NPIs perceived to be useful? Perceived ease of use. Are the proposed NPIs easy to adopt? Attitudes towards usage. How do attitudes and social norms affect the adoption of NPIs? Intention to use. How do intentions of use affect actual use of the NPIs? The focus of our essay is to use the TAM to understand how the dispositional variables can cause dissimilarity in perception towards effectiveness of NPIs. Therefore, understanding the perceived effectiveness of such an important element using the TAM is an imperative research concern. Data analysis. We used a survey which was virtually distributed using the snowball sampling method. Cochrane's formula for continuous data was used to determine sample adequacy. The measurement model is PLS-SEM. The goal of this measurement model is predicting key target constructs and identification of key driver constructs. This method uses the indicator variable's total variance so that it creates linear combinations of indicator variables to denote the relevant constructs. HTMT analysis and bootstrapping was also used. The model shown is a graphic representation of the hypothesis developed for the current study. Testing the hypothesis. The final step in the assessment of the structural model is the estimation of the path coefficients, which in this case coincides with the hypothesis testing. Previous literature had denoted that the values of 0.02, 0.15, and 0.35 indicate the exogenous constructs to have small, medium, or large effect sizes, respectively. The effect size may be the most important finding in the statistical analysis, as with a sufficiently large sample size. Statistical testing can find significant differences that are meaningless in practice. For that reason, the reporting of the p-values is insufficient. The effect size is not influenced by sample size, and therefore it is comparable across different research studies. Results. The results of our study confirmed that attitudes towards usage had a statistically significant impact on behavioral intention in adopting NPIs implemented during the pandemic across both age groups. The study finds a large and medium effect size for attitude towards usage on behavioral intent in people over 55 years and under 55 years respectively. Implications. Age does have an impact on the perceived effectiveness of non-pharmaceutical interventions, and consequently on the various constructs of our model, such as attitude towards usage, perceived usage, behavioral intention, and actual use. Overall, people's understanding of the effectiveness of NPIs strongly influences their attitudes towards use. Factors such as behavioral intentions, actual usage, perceived effectiveness, attitudes towards usage have had the effect and impact of age upon them. Our research states that age plays a crucial role in how NPIs are implemented and used during the onset and offset of a pandemic. Public health authorities should consider better implementation of the NPIs across all age groups to increase perceived effectiveness in the era of new variants. Limitations. Limitations for the study can include the sample size. As noted previously, the survey surveyed just over 270 participants. Participants were interviewed only once and virtually. Responses could have been influenced by factors based on their present dispositions, sincerity in answering the survey, attentiveness, and their rationality. The data collected was not very diverse and distributed. Those surveyed could have been subject to biases or inequity in their responses based on their age, demographic location, education, income level, and the ethnicity they represent. Conclusion. Findings indicate the significant impact of age on almost all constructs on the usage of NPIs. Across both age groups, no significant impact of effectiveness on actual usage was found. The results indicate that the efficacy of NPIs is dependent on compliance by people of all age groups. Tailored communication strategies for different age groups about NPIs should be implemented. Here are our references. That is the end of the slideshow. Thank you so much.